Hello, and welcome to Explaining Autism to Other Children. This is a guide for parents and caregivers. This presentation is sponsored by Libraries Transforming Communities, Millstadt Library, Abilities Behavior Services, and Trinity Services. Abilities Behavior Services is a division of Trinity Services. Here's an overview of today of what we're going to be going over. What is autism? Some autism statistics, how to talk to your kids or others, what is inclusivity, how to teach inclusivity, and some resources that you may be able to use with your own children. So what is autism? Autism is a neurological disorder where a person will have to have deficits in 3 different categories, specifically communication, looking at expressive or talking communication, or receptive communication, like following directions, reading facial expressions, social cues, things like that. Rigid or restricted behavior. So you might be looking at repetitive behavior, behavior that's resistant to changes in somebody's environment or with somebody, obsessions, compulsions, hyperactivity, things of that nature. And lastly, sensory processing difficulties. So this may look like excess seeking or actively avoiding different sensory experiences. And then there's 3 levels of severity. Looking at mild, where the person would be needing little intervention in these 3 deficit categories. Moderate, needing more intervention than someone diagnosed with mild autism. And severe or profound autism, they will be potentially needing lifelong intervention in all 3 of these areas to live a more independent and happy life. Autism statistics. Right now, autism affects 1 in 36 children and 1 in 45 adults. Boys are actually 4 times more likely to be diagnosed. And the average age for a diagnosis of autism is 5. However, most doctors can reliably diagnose someone with autism by the age of 2. So when we talk about autism spectrum disorder, there are lots of other disorders or diagnoses that can also come with autism. So starting at the top and going clockwise, ODD is oppositional defiance disorder, specific learning difficulties, attention deficit hyperactivity disorder, anxiety, Tourette syndrome, obsessive compulsive disorder, developmental coordination disorder. They may be gifted in certain areas of cognitive learning, sensory integration disorder, auditory processing disorder, depression, and attention deficit disorder. So chances are atypical and typical kids will come in contact with each other through community outings or in school. So you may need to know how to talk to your children about autism. So in speaking in generalities, when we're talking about autism, it's best to use person-first language. An example of this is saying, I'm talking with someone who has autism, not I'm talking to the autistic person. Often if we label the person first, it's more of a welcoming experience. And we're not talking about the disability first. Often, if you do have a medical disability, you would not like it if you're at the doctor's office and they talk about foot fungus person. You would be the person with foot fungus. It gives it a different spin and putting the person first and not labeling the disability first. Talking about the uniqueness of everyone. I have this in bold because it can't be stated enough how different each of us are in our likes and dislikes and our ways of doing things, personalities, and perspectives. So just because someone has a diagnosis of autism doesn't make them have any less of these different personalities. Treating others how you want to be treated, walking in their shoes, that's a good way to talk about empathy or different social emotional learning with a child, no matter how old they are. The language just may need to be adjusted for age appropriateness. You can talk to a preschooler about the uniqueness of everyone as much as you can talk to a 30-year-old about the uniqueness of everyone. And to talk about how helping others really is rewarding, whether it's picking up something that somebody dropped or helping them make friends, seeing the joy or the receptiveness of somebody else is truly a rewarding experience. And overall, for some of those little kids who may see autism as something different that they don't want to be a part of, that autism cannot be caught just because you're sitting next to somebody, standing in line with them, or you're even talking to them does not mean that you too are then autistic. So, how to talk to kids about some communication deficits that someone with autism may have. I would stress the use of simple language, such as not using too many words when talking or using slang that may be difficult to understand what the context of that means. With your body language, gesturing to activities, not standing too close to them in certain situations. Facial expressions, being positive, show an interest in them, giving them eye contact, even though they may not be giving you eye contact. And then overall, knowing that that person is learning how to communicate with you, you can learn how to best communicate with them. And there are about 30% of people who are diagnosed with autism that do not speak any words. So, non-speaking does not mean that they do not listen, do not think, do not feel, or have no communicative intent. It just means that they have a different way of talking with others, and that should be celebrated as well. Talk to kids about different sensory needs. So offer items if appropriate, if they seem to be showing interest in something that you have, sharing those items. Give them space if needed. That may also come into reading their own body language and seeing how they're perceiving a situation. Let a person engage in those sensory needs, such as jumping, arm flapping, finger or hand posturing, without judgment. People with autism report that sometimes they may not be able to control those behaviors, and they feel a need for that person. So if you see them really twiddling with their thumbs or with an item, that may fill a need that they have at that moment, and we should not be able to take that away from them. Allow the space for those needs to be met. So if they are engaging in a lot of jumping, I would stand back, give that person space to engage in that behavior. And then refrain from making comments to the person about their actions. If your child does have questions about maybe why that's happening, when they're doing it or any other related questions, encourage them to talk with an adult, like a teacher or their parents, or maybe someone who's with that child, especially if the child with autism is not able to communicate why they're doing those behaviors. So here's some sensory processing activities. So a person may want to be seeking or not want to seek out hearing, things with sight, taste, vestibular, which is a lot of up and down movement, proprioception movement, interoception movement, smell, or touch. And just to recap that, somebody could be sensory seeking or sensory avoiding in any of these areas. So you might see someone who may be wearing headphones in a loud environment because they want to avoid something that's very loud. Or they might be rubbing certain toys because they love the what that sensation feels like with that toy or with that item. How to talk to kids about behavioral needs. If a person with autism is engaging in some behavior, whether it be aggression, running away, something like throwing things around, let an adult interact and step in if a person is having a difficult time. I would encourage kids to not be involved in that situation and avoid approaching using too many words or running up to them. Avoid staring at the individual or making non-helpful comments. Allow them privacy during this difficult time for them. Encourage your child to find an adult to help if one is not present. And then regroup with that person when they're back to their typical baseline self. And don't take it personally. Oftentimes, people with autism engage in those behaviors because they're having a tough time with a situation, and it's not necessarily um, because of who you are, is why they're engaging in that behavior. And to remember that the person with autism isn't giving you a hard time, they're having a hard time, putting it in that perspective that um, again, to not take things personally, and to allow them the space to regroup and calm themselves before uh, playing with them, talking with them, interacting with them. Individualities is something to be celebrated. Oftentimes, we all have our own likes or dislikes that is truly specific to ourselves. And it's important to teach the concept of same but different, that we all may have um, the same food interests, but we also may have different food interests as well. That not everybody is the same in every aspect. And then teaching that differences are needed in each community. Here's a video that I got off of TikTok that is an explanation of autism for children.
as autism. Many
I hope everybody enjoyed that video and bringing me to my next slide of what is inclusivity. Um, how that video ended was um, two individuals interacting with each other, and hopefully they would have included that person with autism in a group. So what is inclusivity? It's thinking about interactions, activities with all abilities in mind. So going outside of just, oh, yes, we need this bathroom to be accessible to all, thinking about how we could make this bathroom comfortable for all. So whether that means having light and fan on a different switch, having a delayed flush on a toilet, having darker lights or dimmer lights as an option in an area. Um, you can't accommodate every single different like or dislike, but having options for those who may have a difficult time going into a public bathroom because of those things. And then equal access to community events or activities. I saw at the Illinois State Fair that there was a very large area that was for individuals that were having a difficult time being at the state fair. I can't remember the specific name that they called it. Maybe it was just a sensory area or a cool down area, but it had comfortable seating, dark lighting. Um, I believe it had some different, maybe calming toys that the person could have access to, and it's open for all. So it wasn't just for individuals who have a disability, but for any person that would be having a difficult time, maybe being overwhelmed with the number of people, activities, things going on. And that is something that is happening more and more in different community events, whether it be a fair or it's the zoo or it's, the science museum or at different um, theme parks, water parks, where they are opening up environments for people to have a quiet time to themselves to either calm down or just be by themselves until they are ready to come back out into a potentially overwhelming situation. Being inclusive is not treating people less than a general population. So you may know somebody who has autism or any other disability like Down syndrome or um, ADHD or cerebral palsy or something where they may need some accommodations. But that doesn't mean that they are less than somebody else. They still have the same worth and value as anyone else. And then allowing everyone to have the choice to contribute to time, effort, ideas in the community. And then overall, just making everyone feel welcome. So, how do you teach inclusivity to others? You may want to look at first volunteering at various organizations in your community, looking at what maybe the needs are of those people in those organizations. And here's some ideas. There's Easter Seals, the ARC, Autism Speaks, or any clinical setting where uh, you may see someone with autism receiving services. I'm sure schools would welcome volunteers as well. There may be some hoops that somebody has to jump through to get approved to volunteer there, but all very worthwhile causes. And talk to your child about how they can help others. And this can just be an overall general idea of how to help others. It doesn't have to be specific to someone with a disability. Encourage your child to ask questions, advocate for others who may have difficulty, and be open for understanding. Be part of groups where buddies are needed, like Special Olympics or in school. Again, going back to that, helping is rewarding. It is definitely a huge perk to see someone feel welcome, heard, seen, and understood when doing things that may be very difficult, like being in a Special Olympic setting, being in a setting like school, where it may be, again, very overwhelming. So being someone's buddy and learning more about how you can help them specifically. And then reading books about individual differences. And I have some resources on those in just a couple slides. And then teaching empathy. So how does it feel to be in someone else's shoes? So here's some resources. These books are mainly geared towards a younger crowd. I'm sure there are a lot more resources out there for middle school and up, but this is what I found for the preschool to grade 5 age range. My friend Julia, and actually Sesame Street has a character on the show named Julia. who is someone with autism. But this is a book, but you can also watch Sesame Street, the episodes where Julia is present to learn more about autism. A Friend Like Simon, which is a book. I See Things Differently. My Friend Has Autism. My Brother Otto. All My Stripes. Autism Acceptance Book. The Girl Who Thought in Pictures, which is a book about Dr. Temple Grandin, probably one of the most famous individuals with autism that has gone on to kind of revolutionize how cows and cattle are taken care of in farming. And this top one with the raccoon, that is a new show that's coming on to PBS Kids in November of 2024. I believe it's called something The Collector. I forget the raccoon's name, but he is the main character and he has autism. My Brother Charlie and A Day with No Words. Any of these can be found either at your local library or searching on a quick Google search. Overall, we want to be kind always to everyone. And thank you for tuning in. I welcome any feedback or questions that you all may have. My email address is listed as lbehme@trinityservices.org. And thank you for tuning in.